Let's bring in Janet Baseman. She is a professor of epidemiology at the University of Washington School of Public Health. And Professor, it's great to talk to you today. I know you've been looking very closely on the contact tracing side, how effective that has been so far. We saw the CDC tweak the guidance a few days ago to focus those efforts more on patients who tested positive in the last 6 days instead of 14. Is this the time to be scaling back on contact tracing at a time when we've seen these infections rise at such a rapid rate?
Right. So the unfortunate reality right now is that cases are rising so quickly that a lot of public health systems are not able to do full contact tracing the way they traditionally would. So there is really a need to prioritize those highest priority contacts for interviews with the limited resources available. And whatever can be done to set those priorities, whether it's those who are most likely to transmit to others because of their living situation or because of the more recent exposure that they've had, to limit that forward transmission, that's what public health agencies need to be doing.
So as a result of this shift in who exactly should be traced, how many cases do you think are actually going undetected?
Well, whether cases go undetected is really more a function of who is getting tested rather than kind of the contact tracing processes themselves. If the question is how many contacts those exposed to those cases are being missed, probably a lot right now, but for various reasons. One is capacity. Another is kind of people's willingness to answer the phone when a contact tracer calls them, when they get them on the phone, whether, cases are willing to share who they've been around is a whole nother issue.
Hi, Janet. It's Brian Chung here. So one question about contact tracing, at least for those that are traveling by air, is that in jurisdictions like New York, for example, they have guidelines on to get tested before you fly and then after you fly. But the problem is enforcement, I guess. It's a guideline, not necessarily a compulsory requirement. So are there better things that local governments or state governments can do to improve the effectiveness of their contact tracing?
Yeah, that's a great question. Enforcement is an issue we're seeing with a lot of public health measures. This is only one of them. It's not our tradition in this country to have high levels of public health enforcement because it turns people away and reduces their willingness to engage with public health. On the other hand, so obviously voluntary compliance is the ideal. There are policy levers that may have to be used in local governments or states in order to kind of get things under control. And the one you're listing is just one of them.
We heard from the CDC director earlier saying that there has been this significant shift from going away from sort of the public square where the spread of the infection was happening in sort of these big gatherings, as opposed to now moving indoors in individual homes, for example, family gatherings that are likely to take place during Thanksgiving. How does that shift make it more difficult for those who are, in fact, looking to try and trace the spread of this infection? How does that change up the strategy, you think?
Well, whether Thanksgiving were happening or not, the scale of the cases that we've been seeing has made it really difficult to identify the sources of all of the cases and outbreaks we're seeing. So that predates the upcoming Thanksgiving holiday. We can attribute some of the cases to clusters and outbreaks. We may know where some of the transmissions happen, but most of them we don't know. So it's already been difficult, and I think the upcoming increase in cases and increasing gatherings in private homes are just going to further complicate the situation.
And something that people might be thinking about as they are heading home, if they are going home or traveling for the holidays, even if it's not the best idea right now, is that quarantine period. There was discussion yesterday from some reporting that the CDC might shorten that quarantine period from 14 days to maybe something between 7 and 10. Do you have any thoughts on that? Is that really a change or an evolution to the way that we're approaching this type of, handling the virus?
Yeah, Brian, I think describing it as an evolution is a really good way to describe it. A 14-day quarantine is a great hardship for a lot of people. And if there is a science evidence-based way to shorten that period through a combination of looking at people's infectiousness period, the time during which they're most likely to transmit to somebody else, and a combination of testing in order to reduce that quarantine period, then that will probably increase compliance, which is really what we want.
And finally, Professor, we've gotten a number of weeks here of good news on the vaccine front, learning more about the efficacy of these vaccines as they come to market. There is that next conversation, of course, of who should get vaccinated first. I'm curious what you're hearing on the local level there, and based on your expertise, how do you think these vaccines should be given? Who should be first, and what should be prioritized?
Right. We need to get our frontline healthcare workers and first responders vaccinated first. A lot of, the speed at which we'll be able to get through those essential workforces early is going to be a function of how much vaccine is available, and then moving on to different levels of priority populations, essential workers, vulnerable populations, and then moving across the rest of the population. There is a light at the end of the tunnel. There's a lot of cause for optimism, but it is a process of distribution, hopefully high levels of uptake across our populations before we're going to see a meaningful population level benefit.
Janet Baseman, Professor of Epidemiology at the University of Washington School of Public Health. Great to have you on today.
Thank you.